You are welcome to online lectures with Pharmacology the schoolboy. Today, we'll take a look at pharmacology. We are still on the topic routes of drug administration. We'll start from where we stopped. In today's lectures, we look at the parenteral routes of drug administration. We look at parenteral routes of drug administration. Okay. So in the last lecture, we listed the different parenteral routes of drug administration. So we'll pick them one after the other. Please watch the lecture on enteral routes of drug administration so you understand better. Now we are going straight to the point. We pick the one after the other to explain. Now, so the first one we want to look at is the intravenous route of drug administration, the intravenous or the popular IV, the IV route. Here, the drug can be given as a lump or bolus. Can be given as a bolus, just once, just give as a bolus or lump, deposit the drug. It can also be given as slow infusion, depending. It can be given as slowly over time, over hours. So depending. As I said in a previous lecture, that intravenous drug administration is shows very fast onset of action. Very fast, rapid onset of action. It doesn't waste time. And the availability of the drug is in the system is 100%. So if you need the drug to be intact in the system at the same time, the amount, and at the same time, very fast action, you need intravenous what? Intravenous what? Infusion. Intravenous what? Injection. Intravenous what? Injection. So this is used for in emergency cases. It's used in emergency cases. It's used in emergency cases, but care should be taken. You should monitor the progress, monitor for the effect, at the same time the toxicity. Yes, but one issue with this route of drug administration is that if there is a reaction, adverse reaction or toxicity, it's difficult to stop it because it's going straight into the bloodstream. So that's the only issue this has. So what it means that you should monitor as you administer. Don't just give and relax like that. No, monitor as you administer. Very important. Okay. So the next one we'll look at is what? Subcutaneous route, SC. Subcutaneous. Here, unlike the intravenous, where the drug using the hypodermic needle is administered that into the what? One of the superficial veins. This one, intravenous. Note the point. Intravenous is administered in one of the superficial veins. In subcutaneous route, the drug is deposited, is injected in the fatty tissue that beneath the skin. It's not inside the vein. In the fatty tissue beneath the skin. A patient can actually self-administer drug in subcutaneous through subcutaneous means, something like insulin. Insulin is administered SC subcutaneously. So a patient can actually do that. Please note this point. Not inside the blood vessels, in this fatty tissue beneath the skin. Very important. Insulin can be destroyed. Easily what? Destroyed in the GIT. It cannot withstand it. So insulin is better administered to the what? SC. Alright, now let's go over to the next one. Intramuscular. Intramuscular. What happens in intramuscular? From the name intramuscular, inside the muscle. What happens in intramuscular? Intramuscular route is deeper than the subcutaneous route. So drug administered intramuscularly, or IM as we call it, go deep inside the muscle, is deposited in the muscle. It deposited in the muscles. And the and the and the another issue there is that for subcutaneous route, just small volume is needed. Small volume is needed for subcutaneous. But if you need large volume, the best way is to go to what? Intramuscular. Muscles of the thigh, the muscles of the what? Buttocks, the gluteal muscles. But be careful why administering here. Of course, you know about the sciatic nerves. You know about the sciatic nerve. So you divide the button into four quadrants. So let us not go there. Let us not go deep into that. But the point I want to make is that the muscle is deeper. The muscle is deeper. It may not be that easily self-administered as you see in the subcutaneous route. And in the muscle own, the muscle, the rate at which the drug is absorbed or leaves the site of administration depend on how vascularized that muscle is where it was injected. Is if it's a place where, if it's muscle part where it is highly vascularized, that means the absorption and the distribution will be high. But if is low, is sparsely vascularized, it may take time for you to do what happen. So that's for what? IM. But please, drug that are administered through IM, the lidocaine is very important to avoid the pain, to lessen the pain at the injection site. Okay. So these are the things I want us to know. Note on this intramuscular. You see there are different drugs. Paracetamol can be administered intramuscularly. There are many of them. Diclofenac injection, there are many of them, can be administered intramuscularly. All right, so the next one I want us to look at is the inhalational. Inhalational has to do with what? Inhaling for rapid action, mainly in patients with asthma and other chronic respiratory tract diseases. So here now the drug is rapidly delivered across the large surface area of the mucous membrane of the respiratory tract and the pulmonary epithelium. In fact, when it comes to the onset of action, they are almost as rapid as what? IV. Almost as rapid as what? IV. Okay. When one of my students asked me that question about the gases and aerosol. Please, I hope you are watching this lecture. I want to use the opportunity to answer the question now. There are some that are formulated as purely gases. They are gas on their own. Some anesthetics, they are gas on their own. But there are those that are prepared as aerosol, suspended, pressurized, so that when you press it, it will come out as if your gas is coming out. But what we deposited is not actually gas. Is so as you see solid itself, liquid, depending on how it's formulated. So inhalational can be in form of gas, purely gas, can be in form of aerosol. Okay. Okay. So another point I want to make here is that okay, okay. I think I've mentioned asthma patients. Yes. Another drugs like drugs that can be administered through this inhalation. I think I've mentioned anesthetics. You also have some drug for asthma and respiratory tract. You have things like albuterol, corticosteroids. Corticosteroids are also there. Example here, fluticasone, sorry, fluticasone, and you also have your, I think, inhaler, salbutamol inhaler is also there. Nebul for nebulization. There are many of them. Okay, so I think I would for gases. Anesthetics are there too. Anesthetics are there. So these are the much you can take. This is the much you can take. This is much you can take on inhalation. Now let's look at intrathecal. Intrathecal. This has to do with the brain and the spinal cord. Specifically, the drug is injected in the spinal canal. The treatment of the diseases of the spinal cord, the brain, or even the meninges. For diseases of the spinal cord, the brain, even the meninges, the covering, the covering of the what, the spinal cord and the what have you. So when there's an issue there, this drug can be injected. So that's what I put the intrathecal. Please note that point. Intrathecal. So here the drug is injected in the what? The spinal canal. The spinal canal. The drugs here are needed for rapid action for the diseases around this place. For diseases around the what? The place. Okay. Anesthetics. Maybe a particular area it need to be numb, maybe for a particular procedure. Anesthetics can be administered through this way, intrathecal, through the spinal canal. Okay. Of course, you know about the infections of this meninges, which is meningitis. Okay. You can treat it anyway. Now, not only anesthetics, even analgesics like morphine can also be what? Administered through this way. Okay, let's go over to the next one. We have the intranasal. From the name intra, inside the nose, intranasal, nostrils, intranasal. Spray can come in here now. Intranasal nasal spray can come in here now. Even nasal drop. But nasal spray is far is preferred to nasal drop. Okay. So here now the drugs is administered directly inside the nose. Inside the nose. Okay. What are the examples of such drugs? Name them. We have nasal decongestant. Maybe we have nasal congestion. You want to decongest the nose, so you can apply nasal decongestant. Okay. Drug like calcitonin for osteoporosis is also available as nasal spray. Even a popular drug we abuse today, cocaine. Cocaine we abuse. Those that abuse it, they sniff it. They sniff it. Okay, we have what demopressin intranasally for the treatment of diabetes insipidus. Demopressin. Desmopressin for desmopressin, not demo, please. Desmopressin for what? Diabetes insipidus. It's also administered intranasally. Okay, so what else do we have here? Okay, I think I've mentioned calcitonin for osteoporosis. Okay, the next one I want us to look at is the ocular. From the name ocular, will mean the eyes. Ocular. So here you have your eye drop, eye ointment. So drugs can be formulated and administered to the eye for local actions. Eye ointment, eye drop, if you apply it, it doesn't stay long in the eye, it will clear, so it doesn't give much contact with the eyes for for the effect to be felt. Yes, so everything is happens fast and it cannot stay for long. So, but eye ointment has a longer period of time to be in contact with the eyes, with the cornea, where the absorption can take place. Now, but the issue is that the eye ointment gives blur vision. So what do you now do? The best thing is to combine the two of them. Since the eye drop, that's why if you go to some hospital, they will prescribe eye drop, they will prescribe eye ointment. The best to do is so during the day, apply eye drop. In the morning, apply it. Before afternoon again, it will clear. Apply another one before. But in the night, when you are sleeping, to avoid the blur vision, you are sleeping already, you want to go to bed, apply your eye ointment, leave it there. Just that once in the night. You sleep, and the eye ointment will have better contact with the eyes for the absorption of the drug. And throughout the night, before the morning, it would have cleared. So your eye will still be clear again. So eye drop is good to use it during the day, morning, afternoon, evening. While eye ointment when you want to sleep. Please note that point for your patient tomorrow. All right. So let's continue. So even eye gel also does the same thing with eye ointment. Okay. What are the examples of drugs that can be formulated as this? We have drugs like acetazolamide, betazolol. We have phenylephrine. We have tropicamide. There are many of them. Maybe if you want to treat conjunctivitis, depending on the nature of the conjunctivitis, is it bacterial conjunctivitis? Is it allergic conjunctivitis? Is it viral conjunctivitis? That determine the nature of the drug we are going to use for the treatment. Is it glaucoma? Is it just pain? The eyes? Of course, we have diclofenac eye drop. We have ciprofloxacin eye drop. We have chloramphenicol eye drop and eye ointment. So the nature of the disease or the condition in the eye will determine the type of eye drop or eye ointment to be used. So let us not dwell much on this. So the next one I wanted to talk about is the topical. I've mentioned it before now. Topical, topical, topical. So what happened in the topical? Topical preparations are mainly prepared for the what? For the what? They are mainly prepared for local action. You have injury, maybe you have muscle strain, or maybe you have you hit your leg somewhere and there is no open wound, but you notice that the place is paining you. You can apply diclofenac or topical analgesic at that point to take care of it. So they have more of local, even though yes, you see how something like diclofenac, you also have it as for systemic effect, tablet you swallow, injection, then you even suppository. You also have it as a cream. You also have it as a ointment, even as gel on the skin, on the body, maybe a particular area where you feel the pain. So it's localized action. It has localized action. Okay. So in such situation, we could call it. We say that we have what is a topical what preparation. You could also have other topical preparation like clotrimazole. Clotrimazole is antifungal for maybe candidiasis. vaginal candidosis. If you apply it as cream at that point in the vagina, at the vulva, around that area, it is what? It is what? It is what? Local action. It will have a local effect at that point. Even though we still have other antifungal that you can still swallow, but this one you're applying it as either as cream or as insert. Mainly as cream, it has local what? Action there. So it's topical. Is what? Topical. Is what? Topical. Okay, you also have it even not just there, even at the skin, normal skin for other skin infections. What am I even talking about? Ketoconazole is also there for skin infection. Glycofulvin is also there for skin infection. These things are topical. They are what? Topical. Okay, now let's go to the next route. We have what? Otic. Otic drugs. We have what? Otic drugs. From name otic, it talks about what? The ear. Otic, ear. For ear disease and what? Inflammation. For ear inflammation and what? Infection. There can be ear infection. You apply what? Drugs in treatment of what? Ear infection or inflammation. Okay, now let's go over this. So we have our ear drops. We have our ear drops. There are many of them. See, most of the drugs, what they do in normal making of action, they do. If you use them, if you formulate them for a particular part of the body, site of action like the ear, if it is suppose acid is fighting infection, it's for the infection of the ear. If it's analgesic, it's to treat pains. If it's anti-inflammatory, it's to treat inflammation in the ear. So there are many of drugs that you can formulate as such. There are many drugs you can formulate as such. Benzocaine can numb the ear numbing. Benzocaine can numb the ear. So please, the eardrop is not dropped deep inside the ear. Very important. It is not dropped deep inside the ear. Very important. Very, very what? Important. Please, it should be dropped at the outer ear canal, not deep inside the ear for other to avoid other issues. At the outer ear canal. So now let's look at the next one is the transdermal route of drug administration. We have our transdermal patches. These drugs are formulated as patch placed attached on the skin for a long-term release of the active ingredient. We pass through the skin and enter the systemic circulation through the vessels there down to systemic circulation. Some some birth control pill, contraceptive are formulated as such. Even nitroglycerin anti-angina pill, nitroglycerin anti-angina for anti-anginal effect is also applied. Remember we mentioned nitroglycerin where I made mention of antihypertensive. Basically is an anti-anginal anyway because of the what? Vasodilation. It's a powerful vasodilator. Vasodilation. So because of the anti-anginal effect, over a long period of time, it can be formulated as what? Transdermal patch to release sustained gradually over a long period of time. Okay. Now, but one thing with this I like about this transdermal patch, unlike intravenous, where once if there is any toxicity or serious adverse effect, you cannot control it because the thing has entered the system. If you notice any issue, you can actually take the patch away, and the patient will not experience much issues. So that's an advantage of this transdermal patch. Remember that remember that nitroglycerin is given sublingually to boycott the effect of the gastric juice in the stomach. The same thing here apply here. It also used transdermally to avoid such effect too. So you can use it transdermally. You can also use it. You can also use it as what? As what? As sublingual preparation. Is there anything we are missing out here? I think we have actually done justice with the routes of drug administration. There are many routes of drug administration. We also have intra-arterial through the artery. Let me not go deep into that. Through the artery. You know that the artery, if you want to administer through the artery, you go deep, not just superficial. You go deeper. You want to administer through the artery, specifically in anti-cancer medications. You want to administer anti-cancer drug because you know the artery supplies the organs, the tissues, this tissue directly, tissues. So that drug you administer is going straight in chemotherapy, going straight to attack the tumor, the cancer cells. All right, so that's all we take on the routes of drug administration. So today we come to the end of the topic routes of drug administration. Please, if you have any question, feel free to ask. Send your question as a comment. You can send through my WhatsApp line on the screen. Please subscribe to my YouTube channel and my Facebook page. The names they have the same name, From Eternity the Schoolboy TV. Share these lectures with your friends, with your colleagues, with your children, with your students. Someone out there may be in need of these lectures, and God will bless you richly, abundantly as you do so. Bye for now. See you next time.